Oh my gosh. Sometimes you and I get so excited, it's almost embarrassing. We get excited about different things, but we get excited at the same time. So I'm so excited for people to hear what Jessica Bell Vanderwall from Frame Fertility has to say today. Such an interesting approach, such an interesting story.
And so much room for growth. But once again, Rachel, we meet a founder or co-founder in this case who literally lived the journey that she is now providing for other people. And sky's the limit in terms of opportunity here. So,
It's so interesting that you say that, Alyssa, because early on in the fundraising journeys that I've worked with founders, the personal story was great. Then there was sort of a sea change where the personal story meant you were too emotional. What was so great about Jessica's sharing was clearly she had this experience and she has translated that into business. She's not trying to say, woe is me, I did this. She's saying, well, I did this and now it's informed what I'm doing and I'm going to build
yeah.
something that helps other people. And she works
Yeah.
with her husband. So that could be a whole nother podcast.
Love that. Let's talk to her. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode. We are so excited to have our guest today, Jessica Bell Vanderwall, who's the co-founder and CEO at Frame, another women's health expert who I had the pleasure of seeing on each coast in the past couple of months. Welcome.
Wonderful. Well, thank you so much. I'm so honored to be here.
Well, we're thrilled to have you. Tell us how you got here. Everybody has a story and we want to hear yours.
Absolutely. I'd be happy to. It's funny because I've listened to so many of your episodes and there's definitely a common theme, which is a lot of us came to this journey because of our own experience. And I think for me, it was this intersection of personal, professional, and then timing, to be very frank. So for me, I've worked in healthcare my entire career, and I started out in public health, but then got into the kind of early stage, digital health innovative space over the last 10, 15 years. And that's where I've been. But I think how I got into the kind of reproductive health and fertility space is I'm also someone that about 7, 8 years ago, which is wild to even realize that it's been 7, 8 years, where has time been? I started down my own fertility journey. And, I have always been one of those proactive people that, tried to go for all of my pap smears and my annual well woman visits. And I thought I was checking all the boxes. And then, like a lot of people, I had issues and I was surprised by that. And I think the biggest thing that I was surprised by is, when I first brought it up to my doctor, I was told not to worry about it. Again, go try, come back in 12 months if it doesn't work. And I think what was shocking to me is then when I did come back, I was quickly sent to a specialist. And at that point, things moved from, somewhat casual to what felt like very chaotic. And I think when I got there, I was also surprised to learn that not only do I not ovulate and was going to struggle with infertility, but I also have PCOS. I have a thyroid condition. So I learned about all these new things that obviously impact my fertility, but are also causing all kinds of other health issues, which in hindsight makes a ton of sense given a bunch of other symptoms that I had. And so
I have to just jump in because my brain is ready to explode.
I love it.
Doctors were trained to tell people, try for 12 months.
Yeah.
And if it doesn't work, come on back.
Yeah.
I'm sorry, but that is just unacceptable this day and age where we are just looking for pretty immediate gratification. 12 months really seems like an eternity. So I'm sorry to interrupt. I just had to really put that in there. But that is the standard amount of time for somebody under the age of 35 to be told to try for 12 months and over 35, maybe 6 months, unless you have a known problem. But hopefully this is going to change.
Yeah.
But to your point, Jessica, you had no reason to know you had a problem until
Right.
you were trying to get pregnant. And that's one of the
Right.
things that came up in our
Yeah.
conversation earlier
Yep.
this week. Is
Yep.
there a way to screen before you're ready to have children to
Mhm.
identify whether you'd have problems? So
Yes.
anyway, tell us how,
Yes.
I imagine this all gave birth to Frame.
Yes. Yes. Yeah. I mean, you're both spot on. And what's funny is, again, just to pause for a minute on that dynamic. I also in no way kind of blame the doctor who said that to me, because to your point, it's the standard of care. Also, I brought this up in like the last 2 minutes of my annual well woman visit. She's got her hand on the doorknob and I'm like, I want to have a baby. And she's like, oh, great. Again, it's not like there was space and there wasn't a lot of time for this discussion. And OBGYNs are so busy, right? I mean,
Slammed.
they're running around between
Not an
visit to
excuse,
visit,
but
visit.
you're right.
Yeah.
100%.
But again, I think I've better understood this now being on the other side. So obviously to kind of flash forward, right? The good news for me is I went through fertility treatment and I have a child. I have a very opinionated 5-year-old that I was just told in our parent teacher conference that she is quite chatty. She is a great leader. And I was like, I love this. This is great to hear. And it's fantastic. I'm on the other side with a great story. But not everyone is that lucky. And frankly, I was older. So if I had wanted another child, which we had thought about, it would have been really tough. I'm now in my 40s, right? And so, again, I think what was shocking to me is it feels like I was missing something. Did I do something wrong? Was there something that I was supposed to do? And I think as I reflected, and this is the kind of interesting timing element, it brought to life a lot of questions for me. And I was able to explore those because ironically, I then give birth right at the beginning of the pandemic. And so there I am, trapped inside a house with a newborn and a lot of thoughts in my head. And I feel like a lot of people during this time frame, your wheels start turning. You're like, what am I doing with my life? What do I want to do with my life?
First of all, I so appreciate your honesty
Yes.
that you said trapped at the beginning of COVID. If I heard one more person say, oh, I gave up sugar, I walk 37 miles a day and I do yoga the other 6 hours. It's like there were some realities that you did feel like the walls were closing in. And here you're a new mom, you're hormonal. And I think trapped for anyone who's ever been home with a newborn for any period of time feels right on.
So true. I will remind Rachel and I that we started our podcast or the, brainchild thoughts of it during the pandemic. So you're absolutely right.
Right. Yeah, I mean, for another day, I also went through postpartum depression at that point in time. I mean, it was really hard being a new mom. And, after you go through fertility treatment, you just want to finally be happy. And it was really tough, to be frank. It was really hard. And so honestly, for any mom, for any parent out there that, had a child, especially the first child come into the world around then, it was a lot. I was terrified. It was a lot. So
my personal theory, and not to diss the royal family, but Princess Kate coming out a minute after giving birth to all 3 kids in the same clothes she wore before she got pregnant, I think set back pregnant women like a century.
Oh, yeah. I mean, it's funny because like flashing back 5 years, I don't feel like I've come out of my yoga pants since then too. Like, it's just like, it just woke you up to like what really matters. And it just, for me, was a interesting kind of turn of events. So anyway, so there I am with a baby, struggling a fair amount, but also really like wheels turning, right? And I think the serendipitous thing is I happen to live in a home with a partner who has been building digital health products for a living, and specifically has been building them for healthcare providers. So as I was, spinning, and to the right of me, you'll see I have a giant whiteboard. I love whiteboards. And whiteboarding all these thoughts. Next thing you know, he's like, what would you want to build? And so we spent a whole year, all we were doing is just learning. So we talked to every patient we could, we talked to every doctor we could. And then he was able to build the first generation of our product, of Frame. And I think, where we really landed is the themes that we heard when we'd go talk to patients, when we go talk to healthcare providers is very similar to what I just shared. This feeling of like, I want information, but I'm not getting it. And so I either go to my OBGYN and they're busy, or I go to a specialist and they're telling me it's IVF. So where's the middle ground? Where do I go? So as a result, people end up on Google and TikTok and all those other places. But then you talk to doctors and they're basically feeling challenged as well. I mean, we have a shortage of every provider type for sure, PCPs, OBGYNs, reproductive endocrinologists too. And they feel like the system is also broken. And so I think where we felt compelled is how do we build this kind of bridge in between? How do we ensure that people are getting answers sooner but also getting to the right care at the right time. And frankly, we're not using resources that are too expensive. Like a reproductive endocrinologist should probably not be having a 45 to 60-minute conversation with somebody who's just asking questions. That's probably not a good use of their time.
My head is sort of spinning. Um, can you take us through like a patient journey or
Yeah.
customer journey on your platform? Because
Yeah.
as Rachel always knows, I never want to leave the doctor out of the loop.
Oh, goodness
We
gracious.
really want to
Yep.
remain
Yes.
in tune with everything going on. So take
Yeah.
us through like how would someone know that they should get on your platform in the first
Yeah.
place? Is it just that incredible curiosity, or is it maybe something
That's great.
sparks some as maybe not right?
Yeah, no, I mean, I'm really thrilled that you asked that. And I hope what I say is, music to your ears, because I will tell you, when we decided to build this platform, especially something that's telehealth, what we knew to be true for ourselves working in healthcare, but just generally, is we didn't want this to live on an island. We wanted it to be
Yeah.
bedded within the current system, especially because it's not like we would ever deliver a baby or do IVF, right? So there's no answer that's going to be complete unless we are embedded with in-person care providers. So at the highest level, what we have built is a collaborative care platform for reproductive health and fertility. And I use those words deliberately because we are collaborating with in-person care providers. And specifically where we started was with OBGYNs, and now it's grown to primary care and reproductive endocrinology. So we literally embed our service in the OBGYN practice. And what I mean by that is, if a patient comes to their doctor and in that last 2 minutes of their annual well woman visit says, I've read about AMH. What is that? Or I want a baby next year. Or I've been trying for a couple months and I don't know why it's
Yeah.
not working. Or I've been trying for a couple of years and I don't know why it's not working. And my partner is also a little unhealthy too. If that happens, they literally, from a click of a button, and I really do mean this, within their EMR, they click an order set that is a frame order set. It sends that information to us. It sends something to the patient. And then the patient now starts working with us. We put notes back into the provider's EMR. It's very much interwoven. And so what we are
Okay.
doing is providing virtual care. We can provide kind of that holistic component around lifestyle modification, nutritional counseling, health coaching, and we also do care coordination. So we're doing all of that underneath the OBGYN, keeping them informed, but also making sure that the patient doesn't get lost in the mix. And so it is very
And
much
what
an extension. Yeah, go
Yeah,
ahead.
no, this sounds and listen, I've been at that hand on the doorknob
Yep,
moment 1,000 times, and then patients come up with, the most important, crucial issue that they've been concerned about,
totally.
and you're literally out of time.
Right.
What if an OBGYN or an REI is not on your platform? Do they then get brought in?
Yeah, it's a great question. So, where I've concentrated our go-to-market so far is with these large roll-ups. So these large roll-ups of OBGYN groups, fertility clinics, PCP. So that's my strategy so far. To your point, there may be a fair amount of doctors that we don't work with today. And so a patient can come to us directly and we will still keep their doctor informed. We will send their records to them. But my goal is actually to embed this further with other care providers and
Okay.
continue to work within the system. So we're still early stage. I want to continue working with doctors across the system. We have about 5,000 doctors where we're fully embedded today. So we're making progress, but still a long way to go, of course.
So here's today's hot flash. There is actually a shortage of reproductive endocrinologists, and that shortage is multifactorial. One primary cause is the mismatch between the increased demand for fertility services and the limited number of training programs.
So Alyssa always likes to keep the doctor in. I always want to know how the money flows. So how
Mhm.
do you monetize? Who's paying? There are lots of players in your ecosystem that you've created. And I imagine
Totally.
one of the hardest things was getting embedded in the
Yeah.
EMR.
Yep.
So I want to know about that. But
Yeah.
first, how does the money flow in this process?
Yeah, it's a great question. So we are paid by the provider group. It's a little bit different depending on what type of provider group we work with. If we work with the fertility clinic, for example, it's a subscription model because we literally see more or less like 100% of their patients. In the OBGYN setting, we want to mirror how they get paid. So we embed underneath them. They actually pay us, but everything that we do is billed through them. So it's really embedded as, again, an extension. So it should be a win-win for both of us
So
because
what is it built under an existing code that the doctor will get reimbursed for?
Yes, exactly. We're using time-based codes. So yes, exactly.
Okay.
It's billed like if they had an extra member of their staff that was super powered with technology doing this type of work and was dedicated to it.
To say I wish this was available. I'm not delivering babies anymore, but when I did, and when fertility and whatnot were really top in mind of my practice. But when I saw on your website, we will take some of the emergency calls during the day with questions or at night, and I just said, where was this when I was in practice? So
Yeah,
that's
yeah,
really, really interesting, and a real time saver for doctors.
yeah.
So
Well, I
your
mean,
back end where where is the information coming from? I'm assuming there's,
yeah,
a large learning model. Obviously, you have an advisory
yeah,
board. How do
yeah.
people know that the information they're getting from you when you take that emergency call or the casual call, um, where does the information come from and how do you verify that it's accurate?
Yeah. Yeah. So we do have our own app. It's a web-based application. It's not a native app, but we have an app where people authenticate through us. And so, on the back end of that, we have our own EMR, everything that you would need to be a virtual care provider. And then again, we are more or less integrated with our provider partners. The great news is my co-founder, like I mentioned, who's also my partner, so that's an interesting wrinkle for us, used to work at an EMR company. He built these products. And so he knew how to connect the dots there in a very quick way. And so again, we have our own set of tools, but it's also linked with where the patient is coming from a referral perspective.
And
Or
Alyssa, from everything I've heard you say, if it's not connected to the EMR, you know,
Doesn't
it
matter.
doesn't
don't
exist.
bother.
Yeah.
Exactly. I mean, we know that, right? And I think the great thing about it for us, though, if you think about it, is we also then know what else has been done for the patient, right? Like, again, I feel like a lot of times these things live on an island. They're not connected to their
Yeah.
prior care. They're not connected to their future care. So obviously what I get excited about is we can see what the patient's journey has been so far and we can continue it. But then we also get to add to that continuity and we get to see the patient then go all the way through to hopefully pregnancy, postpartum. And so that also gives us a window over time to see a longitudinal experience, which is where I get like super jazzed, obviously. So again,
Yeah. Yeah.
to me,
Yeah.
you have to be connected to that data source.
I have to say, way back in the day, as they say, it seemed like the REIs, as they were getting bigger and bigger, those are the reproductive endocrinologists,
Yep.
they were sort of the first people to have on board a nutritionist and a mental health provider, and so many nurses, of course, and extensions of the physicians to really deal with a lot of this. And it seems like you really just built a way better mousetrap that's a virtual experience.
Yeah.
So hopefully patients will have access to both. So would you say that the majority of your consumers come in, pre-pregnancy
Mm.
with no knowledge at all, or pre-pregnancy with a known issue and they really want to learn how to navigate it?
It's a really great question. And to your comment on just quickly on the REI side of the house, you're exactly right. I mean, my goal is that hopefully we built, to your comment, a better mousetrap, but more importantly, one that is going to meet them where they are. When you have technology, when you have this type of interaction with patients, that means at 9 p.m. at night, we can be messaging with them, not just between the hours of 8 to 5. And I will tell you, for patients in fertility treatment, myself included, your spiral time is 9 p.m. at night. Like it is
Okay.
not 4 p.m. when you want to call the clinic, right? So we want
And
to
who
be
works
there.
8 to 5? I mean,
Right.
no one works 9 to 5.
Exactly. Yeah, I was gonna say, don't get me started on that. But yeah, so again, you want to be there when the patient needs you the most. And that's where I think technology can be really fun. And this patient population, you're in your 20s, 30s, early
Yeah.
40s. You want to message back and forth. You want to do something that's like quick.
You're saying that the real magical time for you to be contacted is 9 p.m. How lucky are you? Like the real magical time for an obstetrician is 3 to 4 a.m. So so
Well,
hold on to that.
yeah. Fair point. Fair point. Yeah, I would definitely say, don't get me wrong. There are calls all around the clock, but I would say, a lot of what we do when someone's in fertility treatment is about bringing that stress level down, bringing that anxiety level down. And again, when you're on social media, when you're worried about your appointment tomorrow, it's just as the hours go on in the day and you're by yourself, that's when we see people spiral. And we want to get them at that point in time, not say you have to wait till tomorrow morning to have any type of conversation.
Right.
So you're right. The urgent situations for sure. They never
I
happen on
am
any sort of
curious.
schedule.
I'm curious how you measure outcomes.
Yeah. Yeah.
How do you know that this, it certainly sounds like a better mousetrap. I know you've
Yeah.
successfully raised financing. You are still building a business. How are you tracking whether you're being successful or not?
Yeah. So obviously, again, our customers twofold, right? They are healthcare providers and they are patients. And I will tell you, like, my experience before this was selling into employers, and then our customer was employers and their employees, right? That B2B2C model is tricky. And I
Yeah.
think what we have found and what we know to be true is that the ROI has to be pretty quick in these situations where it's complex like that. And I think at the end of the day, to your comment, the ROI that we see here is pretty fast, because what we're finding is we're helping providers keep their patients and keep their patients longer. We're also helping them reallocate the time that they spend. I mean, in general, with a fertility clinic, as an example, we see the call and message volume drop by about half. We find that
Wow.
nurses save anywhere from 45 to 90 minutes per patient per week, because they're doing that counseling, they're doing the administrative stuff, and we're taking that off. And then the final thing is, again, right care, right time, right? And so to your comment, I think over time, what we really want to build here is a data set that shows that, when we intervene early and we get people to the right care at the right time, we see better outcomes, not just for fertility, but for pregnancy too. I mean, in my situation, finding PCOS when I'm much later into the process is not ideal. You're at much higher risk for gestational diabetes, diabetes postpartum, all these sorts of things like escalate as you move through the journey. And so that's something that we are continuing to build a data set around. And that's a long journey. But again,
Well,
immediately time
what I
savings.
love
for
so much about
patients.
what you're measuring is, oftentimes in fertility, we think of what's your success rate, and you're measuring things that are really impacting a physician's
Yeah.
practice day to
Yeah.
day, his nursing staff. We know burnout in the OB-GYN community, and I imagine REIs are not far behind
Yep.
in terms of burnout. And
Exactly.
how great that you're starting to build the metric. It's not just how many people got pregnant, which ultimately you will do, and hopefully be able to measure that more successful, healthy outcomes are occurring as a result of this. But I think it's one of the things that lots of companies forget to do is really measure the broad impact. This is
Yeah.
a significant impact that
Yeah.
lots of people wouldn't be thinking about.
Yeah.
I have a question because I'm just so excited we get like this. Um, so
I love it.
given the platform and the
Yeah.
integration, and
Yeah.
not that the platform isn't amazing, but part of the secret of the success has to be about the integration.
Totally.
Are you looking to expand this? I know you're trying to grow within um, the pregnancy, women's health, reproductive community, but it seems like this platform would lend itself to
Yeah.
a lot of other areas of care where there are lots of constituents.
I'll just say the short answer is yes.
Okay.
Again, that's what I hope. I mean, I think what's really fun for us is, if you think about it, you can kind of take a left turn and go further into reproductive health.
Yep.
You can take a right turn and go further into pregnancy and postpartum,
Yep.
or you can get more into like broader preventative care and other condition areas. Like I couldn't agree more. And obviously this is a lot of times what I say to people I talk to in the VC community. The opportunities here are endless, right? Because really
Totally.
what we're trying to do is embed ourselves into the in-person care community and make sure that virtual care and in-person are creating a cohesive experience for the patient. And we're also using a broader set of provider types to better utilize resources. So to me, that model can be picked up and put down. So
Yeah, that really brings to mind an important question. And this is something I see in day-to-day practice. What if your algorithms or your AI
yeah.
disagrees with providers on the outside? Because this is the thing. We can be as evidence-based as we like, but there's still an art to medicine. And
Oh,
so
totally.
you're not going to have every provider wanting to practice in exactly the same manner or provide the
Yeah.
same exact device. Not that one is right or wrong. How
Yeah.
does that work itself out?
Such
I
a
mean,
good question.
it's so true. And you're going to find with me, at least, like, I'm never going to be the person that tells you like AI and technology are going to take over here. There is always going to be a need, a critical need for clinicians and for a human-human interaction. Like that's never, in my opinion, going to be the answer if we take that piece away. And to your comment, I also completely agree that it is definitely a science, but also an art to this too. And I think to your comment, the way we have built our system is to be malleable and adjustable based on what the provider wants. I mean, if you take an example of the fertility experience overall, one of our biggest clients at Privia Health, the chief medical officer over there said to me, he said, what I love about your platform is you're not saying this is the only way for this to get done. In fact, we've built these different order sets based on what the doctors want, and they can pick and choose. Some doctors want to have preconception counseling conversations. Great, that is fantastic. Others don't, but the order sets are based on what you want us to zero in on. And then again, we come back to you with that information, and you can give us feedback, but we're never going to say we're going to take over and that's all there is to it, and you might never talk to your patient again. We need each other. And so we want to adjust based on what that doctor wants to spend time on, and frankly, what they don't. And so that's always going to be part of how we think about things.
Yeah, good to hear. Thanks. Great answer for that.
Yeah, well,
We're learning.
Well, totally. I mean, and that would be the other thing I would say is like, we're still in the early innings of this journey from a whole host of directions. But again, I really just feel very strongly that we want to work with doctors. We want to work with the system. And I think we have to be mindful that everybody is going to think about what is the right care for their patient differently. And we want to accommodate that. So, yeah.
So how is the company doing, to the extent that there's any information you can share? Sounds like you're generating revenue and growing. Where are you today and what's coming next?
Yeah, no, I appreciate the question. Yeah, we're at a really fun point in our journey. In fact, the last 6 months have been wild and crazy, and the next year is definitely going to be as well. So I think there's a couple of things that have happened for us. To be frank, we did actually not start selling to providers. We actually started selling to employers. And so I'll acknowledge, like, we learned that didn't work and we pivoted. And that's important. You need to learn fast and you need to move, right? And so when we started selling to providers, that took a bit. That took a bit to figure out the right integration points, to figure out the money flow, just as you mentioned. But I think what's really fun for us is we started with OB-GYNs, and now we've moved to fertility clinics as partners, and we've also moved to primary care. And so I think what's really neat for us is now we're seeing patients at so many different stages. We're accessing people that are in very rural areas that don't have an OB-GYN, don't have a reproductive endocrinologist, so we're extending access to care. So that's been really exciting. And now we are starting to move into other care areas, just as you mentioned. I mean, I think we always knew that was going to be something to consider, but we wondered where people would want to take us. What do patients want more of? What do the doctors we work with want more of? And we're starting to venture into that territory too. So growth has been really fun. And the great news is our customers are fantastic. Again, Privia Health, we're also working with the #1 largest fertility clinic group in the country too. So, I mean, it's been a really fun journey.
That's great.
Yeah.
Okay, so I have one last totally unrelated question. Who's the boss, you or your partner? And how do you decide who does what?
I feel like you really don't have to ask that question, right? As you heard about my daughter, who's definitely the boss. I mean, I guess I would say in our house, it's probably her as the boss more than anything else. But I think that the fun thing for us is
Employees who get out of line.
Yeah. Well, exactly. I think we're two sides of one coin. That's always been the neat thing about us. And ironically, we have worked together before. So we had worked out some kinks. But I think we're different. I love being on the road. I love working with customers. I love the sales cycle. I love going to conferences. He leads our R&D team. He would love to have his headphones on and be in a corner by himself, right? So I think it works really well for us because, again, we're like two sides. And I also think it works really well for us because we're both patients of the infertility journey. I went through my own journey. He went through his journey as a male. And don't get me started on that, like a whole set of other issues, right?
Yes,
so
you
we
got that
represent
right.
those two sides. And I think that's fantastic. So if there was ever going to be a wife-husband team, I think it makes a ton of sense in this arena.
Fabulous.
Well, we so love getting to talk to you. You can see we're like jumping through the screen. So excited answering questions. You've taken such a unique approach that seems to be really changing people's lives. So we'll be continuing to cheer you on and watch you as you spread your wings to other therapeutic areas and more across the family building journey.
Fantastic. Well, thank you so much for having me on again. This was a lot of fun.
Really
Absolutely. And
fun.
where can people find more information about Frame and about you?
Yeah, absolutely. So for both patients and providers that want to work with us, you can go to frameyourfuture.com. So hopefully that's an easy one to remember. And then additionally, you can also find me, at least on LinkedIn. I'm pretty chatty there and would love to engage with people there.
Fabulous.
Thank you
Thank you
so
so
much.
much.
Awesome.
Have a
Thank
great
you.
one.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.